Welcome back. For nearly 2 decades, Miami-Dade County officials have been working on opening a mental health facility that could treat people with mental illnesses rather than arresting them and warehousing them in local jails. The county has spent millions renovating a building and developing a plan to offer services. For years, the county has been promising the facility, known as the Miami Center for Mental Health and Recovery, that it will soon be open. They've been promising that all along, but then nothing happens. Is that about to change? That's the question I have for my 2 guests. Joining me are County Commissioner Raquel Regalado. She has been working on finding a way forward on this issue for months, and Judge Steve Leifman, who has been championing this issue and this facility from the outset. I want to thank both of you for coming in, because I do think this is that day where we've been waiting for a while. Raquel, I'm going to start with you. Commissioner, we've got some news. I think things are finally moving, aren't they?
Yes, we finally have an item. We finally have an agreement. It has been a very long process, and I want to thank Judge Leifman for really forcing the county to take a position on this. He was talking about mental health before it became sexy, and the last thing that we want is to turn our jail facilities into homeless shelters. So everything kind of converged over the last year and a half, and we've been able to find a provider, find the funding, and bring an item, which now I am bringing to Policy Council tomorrow, that will then go before the Board of County Commissioners, hopefully in our next September meeting. And it's already in the budget. We're ready to go. Once we get this passed, we'll be able to start purchasing the furniture and really providing the service that our community so very much needs.
So again, I'm just going to recap, because I think it's important to understand. It's somewhere between 16, 18 million dollars, somewhere in that range, that's been allocated for this coming year. You found a provider to actually provide those mental health services. That was one of the stick-ups. That was also, you also, as you said, got the furniture, all those sorts of things. So we're finally going to be able to move forward. On Monday, it goes before a committee on the County Commission, and then hopefully within 2 weeks after that, it gets finally approved by the County Commission, and then we should be able to see it open when, Judge Leifman?
Hopefully first quarter next year.
All right. So why is this facility so important?
Because we are spending hundreds of millions of dollars a year warehousing people with mental illnesses that could be treated. We spend about $414 million a year just to warehouse people with mental illnesses in our jail. We did this amazing analysis. We looked at everybody with a serious mental illness over 5 years that are eligible for diversion to a program. It came out to 16,000 people over 5 years. Over the last 5 years, they spent over 1.2 million days in the Dade County Jail at exorbitant cost, and we got nothing for it. We just keep repeating the bad program problem again and again. This will break the cycle.
Because you're not getting the services you need in a jail setting.
No.
But you're still paying $325 a day.
Per person.
Per person. So it's a very expensive, and also, like you said, it's just a loop. It's just a loop. And it's only going to get worse, because now, starting October 1st, we have to arrest people for being unhoused. And the majority of the people who are unhoused and in encampments have schizophrenia or are bipolar. So now we're going to have even more people in our jails. And one of the things that our item does is divert those people so that they never see the jail and they go directly into this facility.
And remember, when they're in jail, the county has to pick up 100% of the cost. And people don't understand, but they also have really serious primary health issues. Yeah. So their primary health care, their mental health care has to be paid by the county 100%. The second they move over into this facility, most of them become eligible for Medicaid, and we're able to leverage the federal dollars to substantially reduce the cost to the county. So you improve public safety, you save taxpayers hundreds of millions of dollars, and you give people an opportunity of hope and recovery that they haven't had. And we break the cycle, and Dade County becomes the first county in the United States to functionally get rid of homelessness.
Commissioner, I don't want to get into a blame game, but why does something like this take so long? I mean, when I said at the outset that this has been a plan in the works for decades. It's true. And I give you all the credit for stepping forward and taking an issue that doesn't have a lot of upside. You know, it's not like you're going to win a lot of votes from mentally ill prisoners, you know, as a result of giving them decent and humane treatment. So why is it taking so long?
Well, I think we had differing policies at the county commission, and there was a shift. There was, at first it was, and then it wasn't. You know, I think it's a difficult issue. Look, whenever we talk about jails, about criminals, about homelessness, you and I, you know, talked about this when I worked with Carlos Martinez on civil citations when I was a school board member. People accused me of hugging thugs. You know, that actually happened. We did the first civil citation diversion program. You know, now everyone embraces it, and it's such a wonderful thing, but it was very difficult when we do it. So I give him credit. He's a visionary. He's done amazing work getting policy makers to come forward. But then we reached a fiscal issue, right? There was the provider, the fiscal issue, the procurement issue, the logistics, and a lot of times in government, that's where you get jammed up, and I know he was frustrated, and it was just a matter of bringing the right people to the table. I want to thank the mayor and her staff for helping us with this. The mayor has really been wonderful and very supportive, as been staff, and we had to negotiate. He'll tell you, I'm a tough negotiator. We had to negotiate a few things, you know.
Wait, he wanted more money. Yeah. He did, you know, but it's important. And what's key here is, and why this is so important, what this step is because once this opens, once this starts moving, then it will, if it needs to grow, it will grow.
Yes.
And it's sort of like getting that foot in the door finally and tackling this issue in a meaningful way.
And he doesn't have to raise money, and we're working on
the other
pieces of it.
We're raising philanthropy dollars. We have a huge grant we just put in yesterday that is a game changer. Also, what this will do is major research. We're going to be able to show how much money this saves, how it improves public safety, and it's going to be a workforce development. We don't have enough workers in this community to do this work either. So there'll be internships, fellowships, residencies, all in this building, so we can grow our own staff.
Mental health and rehabilitation, and it is a national model.
And I want you to repeat the one number you glossed over quickly. How much money has been spent? How much money will likely be saved because this is open?
Hundreds of millions of dollars.
Well, I think you said 400 million before?
Yeah, a year.
400 million a year.
Yeah.
For a $16 million or a $17 million investment.
It's a no-brainer.
Yes.
All right. We're going to have to end it there.
Okay.
I
want to thank the commissioner and the mayor. They really have stepped up on this. You know, part of the problem, you had a new commission and a new mayor inherit another project. And so there's a lot of re-education. They weren't that familiar with it.
I got to cut you
everybody's
off. All right, but we're going to stay on top of this issue. You can be sure. We're not going anywhere, although we'll be right back now after the break. Bye.